What if I told you that the greatest enemy of your longevity doesn't arrive making noise, knocking down doors, or causing unbearable chest pain right away, but rather whispering signals that you ignore every day? The vast majority of people over 60 live under a dangerous illusion, the belief that high blood pressure is a silent disease that only manifests itself when collapse is imminent. Unfortunately, this is a lie that costs thousands of Brazilians their autonomy every year. The physiological truth, which few doctors have time to explain in their offices, is that before a sudden heart attack or stroke that paralyzes the body, your vascular system emits a series of red alerts. These are subtle biological whispers disguised as fatigue, natural aging, or stress, but which are actually cries for help from a body operating at the limit of its hydraulic capacity. In this video, we're going to do something different and vital for your future. I'm going to give you an early warning. Compass. We're going to deconstruct the myth that you need to wait until you're unwell to seek help. I'm going to reveal 5 specific physical signs that are rarely associated with hypertension by common sense, but which are precise clinical indicators that your blood pressure is dangerously high right now. What you're going to learn here isn't just informative, it's a survival tool. By the end of this content, you'll be able to identify your body's hidden language, allowing you to act before irreversible damage occurs to your kidneys, heart, or brain. We're talking about preserving your ability to walk, think clearly, and see your grandchildren grow up. But before we delve into these life-saving signs, I need you to be honest with yourself and participate in this conversation, as this helps solidify the knowledge. Do you usually measure your blood pressure regularly at home, or are you the type who only checks it when you go to the doctor or when you feel something is very wrong? Answer here in the comments with, "I always measure it," or "only at the doctor's." This answer is important because, as we will see below, blood pressure is volatile, and often the moment when you are not measuring it is precisely the moment when your body is experiencing the greatest stress, and this unintentional negligence is the root of the problem we will address today. To understand why these signs appear, we need to look inside your arteries now. Imagine your circulatory system not just as pipes, but as a high-precision hydraulic system. The central problem we face in maturity is the normalization of symptoms. You feel a discomfort, a twinge, or a buzzing sound and think, it must be age. But physiologically, what's happening is continuous aggression. When blood pressure rises and remains high, what we call chronic hypertension or hypertensive spikes, the blood doesn't flow smoothly, it swirls. It pounds against the walls of your arteries, the endothelium, with the force of a fire hose connected to a garden tap. This mechanical force creates microlesions, tiny internal wounds that your body tries to heal, making the vessels stiffer and narrower, in a process we call accelerated atherosclerosis. This vascular stiffness is the great silent villain. It doesn't just affect the large vessels of the heart, it destroys the microcirculation, the tiny capillaries as fine as hair strands that irrigate extremely sensitive areas like the retina in your eyes, the inner ear, and the deep structures of your brain. That's why the symptoms I'm going to show you are so varied and often seem unrelated to the heart. Hemodynamic science shows us that when blood pressure is uncontrolled, these small vessels are the first to suffer spasms or microscopic ruptures. It's not just a hypertensive crisis that leads to a hospital trip, but that consistently high blood pressure, day after day, that undermines the function of your organs without you realizing the severity until the function is compromised. The data is alarming and reinforces the urgency of what we are discussing. Organizations such as the Brazilian Society of Cardiology and the American Heart Association consistently point out that hypertension is the #1 risk factor for cardiovascular death and strokes worldwide. The most frightening thing is that about half of the people who have high blood pressure don't know it, or they know but don't control it adequately, precisely because they wait for dramatic signs like chest pain. However, the body gives signals long before the drama. Studies show a direct correlation between untreated blood pressure spikes and small ischemic events, mini strokes that go unnoticed, but which, added up over time, lead to vascular dementia and loss of mobility. You don't want to be part of that statistic, and the knowledge I'm about to share with you is the vaccine against that ignorance. Now that you understand the mechanism behind the danger, let's get straight to the point. I've prepared a structured list of the 5 most ignored physical signs of high blood pressure. I ask that you pay close attention. Don't skip any items, because sign number 5 is the most confusing and often leads to misdiagnoses of neurological problems when the problem is actually vascular. And number 1? Well, number 1 is something you may have felt last night and didn't even pay attention to. Let's begin this journey of self-knowledge now, transforming fear into control. Get ready to take notes, because your health depends on these details. The first sign on our list is something many elderly people accept with resignation, but which can be the sound of imminent danger: tinnitus, or what we technically call pulsatile tinnitus. Imagine you are in a quiet room, about to fall asleep, and you start to hear a constant hissing sound, like a distant cicada, or worse, a rhythmic sound that accompanies your heartbeat, an incessant shh inside your head. Popular wisdom and even some outdated professionals might tell you that this is just a sign of aging or natural hearing loss, but I need you to be very careful with this simplistic interpretation. When this ringing appears without an ear infection or obvious external cause, it is often the auditory manifestation of your blood pressure reaching critical levels, transforming the smooth blood flow into a noisy whirlwind that reverberates in the bony structures of your skull. To understand the seriousness of this, visualize the arteries that pass near your ear canal, such as the carotid and jugular veins, as garden hoses. When the water pressure is normal, the flow is silent and constant. But if you drastically increase the pressure and narrow the hose outlet, the water comes out violently, making noise and vibrating the rubber. That's exactly what's happening inside you. Blood is passing with such force and turbulence through hardened and narrowed vessels that your ear picks up this mechanical vibration. This isn't an ear problem, it's a plumbing problem under maximum stress. The practical instruction here is clear and allows no delay. If you notice a new or suddenly worsening ringing in your ears, don't schedule an appointment with an ENT specialist first. Measure your blood pressure immediately. Ignoring this auditory alarm from your body means missing the chance to prevent a stroke, because what's happening near your ear is also happening inside your brain. Moving on to the second sign, we enter a territory that generates a lot of fear, and rightly so: visual fog or bright spots, known in medicine as photopsia. Have you ever had the sudden sensation of seeing small points of light like stars or flies buzzing around, or noticed your vision becoming slightly blurry, as if there were a thin fog in front of your eyes, even while wearing your glasses correctly? This symptom is a cry for help from your microcirculation, the retina, the tissue at the back of your eye. Responsible for capturing images, is nourished by tiny and extremely fragile blood vessels. When systemic pressure rises, these microvessels suffer violent spasms to try to contain the excessive flow, or worse, begin to leak fluids, initiating what we call incipient hypertensive retinopathy. This sign is crucial because the eyes are literally the window to the brain. The blood vessels in your retina are anatomically similar to the vessels that irrigate the deeper parts of your central nervous system. If you are seeing flashes or fog due to pressure, it means that the brain tissue is also suffering from the same vascular overload. The emotional pain here is palpable. The fear of losing your sight, of no longer being able to read a book, drive, or recognize the face of a loved one. Therefore, consider any sudden visual change not as a glasses prescription problem, but as a potential vascular emergency. If this happens, sit down, calm down, and check your blood pressure. Protecting your eyes at this moment is, in fact, protecting the integrity of your brain from much more severe damage. Before we reveal the third sign, which is often mistaken for a simple bad night's sleep, I want to take a quick moment to ask you, are you noticing how subtle these signs are and how easily they can be confused with everyday fatigue? That's exactly why our channel exists, to bring clarity where there is confusion and give you the tools to live longer and better. If you want to continue, Receiving this type of medical guidance translated into real life, protecting not only yourself but your entire family. Check now if you are subscribed to the channel and leave your like. This simple gesture helps the video reach other people who at this moment may be ignoring a ringing in their ears or a dangerous headache. Together, we can save lives with information. Now pay close attention to number 3, as it's responsible for many cases of dangerous self-medication. Morning helmet. Headache. Unlike a migraine that throbs on one side or a tension headache in the forehead, this pain has a very specific characteristic. It's located in the nape of the neck, in the occipital region, as if you were wearing a tight helmet on the back of your head, and the most revealing detail is when it appears, mainly upon waking. You open your eyes and the pain is already there, heavy, uncomfortable, and curiously it tends to improve a little as you get up and start moving or stand during the day. This is not a coincidence. It's pure physiology working against you. The scientific context behind this morning pain lies in the circadian rhythm of blood pressure. Naturally, our blood pressure rises slightly before we wake up to prepare the body for the day. This is called the reverse night dip. However, in uncontrolled hypertensive individuals, this morning peak is exaggerated and dangerous, placing immense strain on the cerebral vessels in the first hours of the day. The fatal mistake many make is waking up with this neck pain, blaming the pillow or sleeping position, and taking a common painkiller. The medication masks the pain, but the pressure continues to silently damage the arteries. If you wake up with a heavy neck, don't reach for the medicine cabinet, go to the blood pressure monitor. And this becomes even more evident when you understand the next point, which explains why simple activities like walking to the gate suddenly feel like exhausting marathons. We've reached the 4th sign, one of the most neglected, because it directly affects the vanity and self-image of those who are aging. Disproportionate fatigue and mild shortness of breath. I'm not talking about that pleasant tiredness after a day of work or exercise, but rather that exhaustion that arises when doing simple things that, until recently, you handled with ease. You know, when you climb half a dozen steps, walk to the gate, or carry a light shopping bag and need to stop to catch your breath, feeling your heart beat erratically. The immediate instinct is to think, I'm getting old and sedentary. But biology tells us a different and more worrying story. This tiredness is not just a lack of physical conditioning, it's a classic sign that your heart is losing biomechanical efficiency due to the constant struggle against high blood pressure. To visualize what happens, think of your heart as a muscular pump that needs to push blood against resistance. When your arteries are stiff and your blood pressure is high, this resistance increases dramatically. The heart, being a muscle, reacts to this extra effort by thickening its walls in a process called left ventricular hypertrophy. It may seem good to have a strong heart, but in cardiology, a heart with thick walls loses elasticity. It becomes stiff and cannot relax properly to fill with oxygenated blood. The clinical result is diastolic heart failure. Blood accumulates in the lungs because the heart cannot drain and pump it all quickly enough, generating this subtle shortness of breath. Don't accept the couch as your destiny. If fatigue arrives suddenly, check your blood pressure before blaming age. Now, we enter the most sensitive and perhaps the most frightening territory on our list. The 5th sign, subtle mental confusion and sudden anxiety. I deliberately left this point for last, as it is often confused with the onset of Alzheimer's or psychiatric disorders when the root is purely vascular. Have you ever had moments when, out of nowhere, you felt an inner agitation, an anxiety without apparent emotional reason, as if something bad were about to happen? Or perhaps small lapses in memory, difficulty finding words, or a mental cloud that lasts a few minutes. Most people rush to the neurologist or psychiatrist, but the first step should be to measure blood pressure. The brain is the organ that consumes the most oxygen and is extremely sensitive to fluctuations in blood flow. The scientific explanation for this is both fascinating and terrifying. High blood pressure damages the blood-brain barrier, a protective layer that selects what enters the brain. When blood pressure rises too high, hypertensive spikes, this barrier can become permeable, or small blood vessels can suffer microangiopathy, small vessel disease, reducing oxygenation in critical areas of thought and emotion. This anxiety you feel is not psychological. It's an adrenergic discharge from your body trying to compensate for vascular stress, a physiological warning that the system is in danger. Ignoring these episodes, thinking it's just life stress, is opening the door to vascular dementia in the future. Protecting your blood pressure is protecting your essence, your memory, and who you are. However, recognizing tinnitus, blurred vision, neck pain, fatigue, or mental confusion is useless if you make basic mistakes when confirming your suspicion. Therefore, our sixth point is a corrective topic. Measurement error. The only absolute truth about your vascular health is not what you feel, but the number the device shows. However, I see people daily making decisions based on false numbers. Measuring blood pressure is a technical procedure that requires rigor. If you measure your blood pressure right after drinking coffee, with a full bladder, or while talking to someone, you are gambling. Studies show that talking during measurement can increase the reading by up to 10 to 15 mmHg, creating a false diagnosis or masking a real crisis. I'll quickly list the 3 mistakes you should eliminate today to get a reliable reading and save your life. First, posture. Measuring blood pressure with your legs crossed or with your arm hanging down without support at heart level completely alters the hemodynamics of venous return and the arterial resistance reading. Second, timing. Never measure immediately after an argument or physical exertion unless you feel warning symptoms. Ideally, you should be at rest for at least 5 minutes. Third, and most common, a full bladder. The urge to urinate stimulates the sympathetic nervous system, which constricts blood vessels and artificially raises blood pressure. From today onwards, your measurement routine should be sacred. Seated, feet on the floor, arms supported, empty bladder, and in absolute silence. This is the ritual of truth. We've reached the end of this list, but this is just the beginning of your new outlook on life. The thesis we defended at the beginning of this video has proven true. High blood pressure is not a silent killer for those who know how to listen. It whispers before it screams. The ringing in your ears, the flashing light in your vision, the helmet on your neck, the fatigue on the stairs, and the sudden confusion are the words your body uses to cry for help. The tragedy of a stroke or heart attack often doesn't happen out of nowhere. It's the final chapter of a book that was written page by page, symptom by symptom, and that wasn't read in time. But today, you've learned to read that book. You've broken the cycle of ignorance and the normalization of suffering. I want you to feel at this moment, not fear, but a profound sense of power and control. Most people your age are adrift, depending on luck, but you now have a warning compass. You know that morning headache isn't solved just with painkillers, but with medication and lifestyle adjustments. You know that sudden anxiety can be your brain's cry for oxygen. This knowledge removes you from the position of potential victim and places you in the role of guardian of your own health. Longevity isn't just about living a long time. It's about living with the autonomy of someone who understands and respects the biological machine they inhabit. Now, I have a practical mission for you. Don't let this video be just another fleeting entertainment. I want you to grab your blood pressure monitor or get one and take an accurate measurement. Today, following the steps I've shown. And more importantly, I want to create a chain of protection here in the comments, right below. I will pay attention to sign number and say which of the 5 symptoms surprised you the most or which one you've already experienced and ignored. Your experience can serve as a warning to someone else reading the comments now and going through the same thing. Share this video in your family group. If you save one life with this sharing, it will have been worth it. Remember, your body is your temple, and it communicates with you all the time. Medicine can give you remedies, but only you can give it the attention it needs every day. Subscribe to the channel to continue learning how to decipher the signs of your health and age with the strength and clarity you deserve. We are together on this journey towards a longer, healthier, and above all, more conscious life. A big hug, take care of your heart, and see you in the next video. Legal notice. This Content is purely educational and informative. The information presented here does not, under any circumstances, replace professional medical advice, diagnosis, or treatment. Never discontinue the use of medications or start treatments without the express guidance of your cardiologist or trusted physician. If you identify severe symptoms or hypertensive crises, seek emergency medical attention immediately.